One fine morning, Eddie and Granny were off for a safari. When they approached the bus station, Granny started complaining of chest pain. Moments later, Granny fell and collapsed. Eddie was so scared that he began to cry. Luckily, an ambulance passed by and rushed Granny to hospital. While in hospital, Eddie met Dr. Cab. He was so charming and friendly. "Why are you named Dr. Cab?" Eddie asked. Dr. Cab smiled and told Eddie to follow him. He took him to a conference room where he not only told him what Dr. Cab meant, but also taught him what to do when someone is in cardiac arrest. Here is what he learned. When someone's heart stops beating, they are said to be in cardiac arrest. When this happens, you need to begin CPR immediately. Typically, the victim becomes unresponsive, stops breathing, or does not breathe normally. When this happens, send someone to call 911 and get an AED. If you're alone, get an AED and call 911. If an AED is not available, begin CPR immediately. CPR stands for cardiopulmonary resuscitation. It involves giving compressions and breaths in the ratio of 30 to 2. CPR helps to push blood so that it reaches vital organs such as the brain. Dr. Cab, therefore, is an acronym that helps us to remember the correct order of CPR: compressions, airway, breathing. During CPR, push the chest down at least 2 inches, push hard and fast, and allow the chest back up. The recommended rate for compressions is 100 in a minute. If you're not trained in CPR, continue pushing until help arrives. If you're trained in CPR, give 30 compressions, open the airway, and give 2 rescue breaths. Continue the Cab cycle until the patient's condition improves, paramedics take over care, or an AED arrives. An AED is an electronic device that helps the heart return to a normal rhythm. It is easy to use as it prompts you on what to do. So once it is available, attach it to the patient and follow the instructions. Just to recap, Dr. Cab stands for danger, response, compressions, airway, breathing. In a nutshell, ensure that you are safe, call for help, give compressions, open the airway, and give rescue breaths. Having learned a lot, Eddie went to see Granny. Granny was doing a lot more better now. Days later, they went for the safari.